Hello, I am Professor Dr. Syed Arshad Husain, consultant pulmonologist at the King's College Hospital. I am also professor in pulmonology, adjunct in Gulf Medical University in UAE. It gives me immense pleasure to talk about an important topic today, which is asthma. In asthma, the problem is that symptoms can suddenly become worse when we have triggers in the background. So I'm going to talk about the triggers in asthma. The commonest triggers are usually flu or viral illnesses, and children bring that into the house from the nurseries. So the viral illness, as it's come, causes a flare-up of the asthma. So this is one of the important triggers. The usual viruses are influenza A and influenza B. Sometimes COVID viruses can still affect us. And the other thing is a bacterial infection. So bacterial infections can happen, and when they come in, they also act as triggers. So these are very important triggers, the infections. There's a lot of dust in the environment, and because of the dust, asthma, there could be triggers for the asthma as well. So dust and house dust mite is a very important common trigger for asthma. The other triggers we have to understand is if you have pets in the house, the fur in the atmosphere, which could be the cat or the dog, dander in the atmosphere can be a trigger. Cold weather can be a trigger, exercise can be a trigger, smoke from smoking or pollution in the environment can also be a trigger. And also remember that other triggers which are very important is the spores and the fungus that could stick into the air conditioning vents. And if you haven't got the vents of the AC cleaned in the last 6 months, there's a good chance that you're breathing air which has some fungus spores and molds, and that could also cause problem. Similarly, the grass and also the pollen can be a trigger. So all these things are very important, including, I said, smoking, that the triggers should be prevented as much as possible. Once the trigger is started, the symptoms or a cascade of reactions, then it's very difficult to control the asthma until an appropriate strong good treatment is given. So a trigger can spark the symptoms, and these symptoms continue. A lot of people come to me saying, I had influenza virus, and since then I've been having the cough, or I had a COVID virus, and since then I've been having the cough, or shortness of breath, or other symptoms. So this is why these triggers are very important to identify and to avoid as much as possible. And sometimes vaccines are good for flu illnesses, viral illnesses. And certainly hand washing is very important. When children come from home, there should be very big importance given to hand washing, and same with the hand washing in the house. And this can spread from holding the objects in the house. So these are important things. And then again, the asthma symptoms are again important to understand. They're cough, shortness of breath, wheezing, chest tightness, nighttime symptoms. Sometimes people are unable to speak in sentences, and that's a grave sign that asthma is getting bad. I've talked about peak flow today as well, that peak flow is a very important guide, and if you're deteriorating the values, then it does suggest you need some attention from a consultant pulmonologist or see your doctor. So I hope I've covered the topic of triggers in asthma well today. There are few things we can cover in a short time, but there are a lot of other triggers which I haven't touched on. But to understand triggers is very important, and avoidance of these triggers is again very useful. So if you have any questions still about this topic, do please contact us through the website or through our email address. Thank you.